Hello, I'd like to say a few words about our most recent board meeting, inevitably overshadowed by COVID and the preparations that we have to make for a second wave of the pandemic. Unfortunately, cases have been rising locally. And it could be, as we discussed, our financial situation, which will be tougher in the second part of 2020-2021, that we won't be fully compensated for the costs of COVID, which clearly would have an impact on our services, unfortunately. We are going to move to electronic prescribing. Our doctors, nurses, pharmacists will dispense with paper, and using digital formulae will, we hope, produce a much more consistent and error-free means of helping our patients and service users with the drugs that they need. Some of those patients are what's called stranded. They're well enough to go home, but unfortunately they have no home to go to, and we discussed ways in which we might better collaborate with our colleagues in the district councils, the housing associations and the voluntary sector to try and help those people find somewhere decent to live rather than stay unnecessarily on our wards. We discussed new initiatives on suicide prevention. We heard from our cultural ambassadors, members of staff from Black, Asian, minority ethnic backgrounds who've been helping us with sometimes difficult human relations issues and perceived racial injustice on the part of our staff. A tremendous assistance, which programme will continue. We heard from our what are called allied health professionals, that's to say speech therapists, dietitians, physiotherapists, some of whom did tremendous work in moving away from their own discipline during COVID to help colleagues, particularly in the mental health area. This is a body of our activity which they're neither doctors, neither nurses, and sometimes don't get the full recognition that they deserve. So we were really glad to hear from them.